If you have seen many commercials talking about a Medicare Advantage plans that help cover your Part B premium, then this video is for you. Hi, I'm Jessica Manion with My Healthcare Direct. I'm an independent agent, and what I like to do is help educate people on their Medicare options so that they may pick a Medicare plan that best fits their needs. So first I'm going to be going over what these commercials are saying when they talk about a Part B reimbursement, as well as the potential pros and cons to enrolling in these types of plans. When it comes to being enrolled in Part B, unfortunately it isn't free. And in 2022, the monthly premium for Part B for the average income earner is $170.10. This is much higher than it has been in years prior, and your Part B could be even higher if you are a higher income earner. Because Part B went up an additional $21.60 from last year in 2021, that had affected a lot of people, and because of that, the Part B reimbursement plans have become more attractive than ever before. So the Part B reimbursement or reduction, or also known as a Giveback plan, essentially gives you money back into your Social Security. So rather than paying the full $170.10 out of your Social Security check, you will pay a reduced amount. Now, if you are not taking Social Security at the time of enrolling in one of these plans, then your bill will simply be reduced by the amount that is set by the plan. So when it comes to enrolling in a Medicare Advantage Part B Giveback type plan, besides one of the biggest pros, which is getting money back into your Social Security check each month, you don't have to pay anything additional to have this plan. It can also have some additional benefits that original Medicare does not include, which are dental, vision, hearing, some over-the-counter benefits, as well as Silver Sneakers, which is a free fitness membership. Now, having all these potential benefits can have its own cost to it. Since these plans are managed by private insurance companies, you will see co-pays and or co-insurance to help cover a majority of your medical costs. These Medicare Advantage plans have also a maximum out-of-pocket, and in 2022, the highest maximum out-of-pocket is around $7,550. So it's very important that you understand the limitations of the plan that you're potentially enrolling in before making that decision. Because if you have an injury or an illness, that out-of-pocket maximum can play a role in that decision on whether or not you would like to enroll in that plan. Now, not all plans have that same maximum out-of-pocket. Each plan is different. However, you want to make sure you know that number before enrolling in any plan, regardless of whether it's a give-back plan or not. So one of the cons to one of these plans is, of course, the network. Because a lot of the Part B Giveback plans tend to be HMO plans, not all of them, but quite a few of them do seem to have HMO. Now, one of the cons you could say about one of these plans is having to deal with the network. So while many of these plans are HMO style plans, not all Giveback plans are HMOs, but a majority of them, especially ones that I've seen throughout the country, are HMO style. This means that you would need a referral from your primary doctor in order to see a specialist, as well as having to make sure that you stay in network to receive benefits. So if your doctor says that they are in network and you enroll in this plan, that's fine. But if you find a doctor that you really like, however, they are not in network with this Giveback plan, then you will have to pay a higher out-of-pocket cost to go see them. Now, one of the costs or cons to these types of plans is dealing with the network. Now, while a lot of Giveback plans tend to be HMO, not all of them are like that. So you want to make sure that you check your area to see what types of plans are Givebacks. But many of them are HMO plans, which means, for one, you will need a referral from your primary doctor in order to see a specialist. The other important thing is dealing with the network. With an HMO plan, you do have to worry about making sure that whatever facility or doctor you visit is in network. Otherwise, your plan will not pay for any covered services. So another thing to take into consideration is making sure that whatever doctor or doctors that you are seeing accept the plan before enrolling. Now, the big hitch or potential catch with that is that doctors and insurance companies can go in and out of network throughout the year. So if your doctor is saying in January that they are taking the plan, by July they may no longer be in network. So that could be a potential downside to enrolling in one of these plans, especially if it's an HMO plan. Now, there is good news if that situation happens to you where your doctor was once in network but is no longer in network with your plan. There is an annual election period that is run from October 15th to December 7th where you can make a change to the plan you're currently on for the following year. So if you are on a Giveback plan and your doctor is no longer in network and you really want to keep that doctor, you can make a change during that time, and come January 1st, your new plan will start where your doctor is on that plan and you can continue to see them. Now, these plans can and will change from year to year, so it is important that every year you always evaluate the plan you are on and compare it to the plans that are available in your area to make sure that you are on the best plan that meets your needs. You may also see as a trade-off for having a Part B Giveback plan that some of your costs would be higher, for example, co-pays for doctor's visits, or maybe the dental benefit isn't as good, or maybe they don't have any dental or vision benefit because you're getting a Part B Giveback. So you really want to weigh your options on what is the most important to you in terms of the type of coverage you're seeing versus what you're paying to have Part B. For some people, these Giveback plans can work great because it saves them money monthly and they don't really use the plan very often, so they're not as concerned about doctors or co-pays or any additional costs. But for others, it might not be a good fit. So it really depends on a person-by-person basis and what your situation and what your needs are. And that's where I come in, because as an independent licensed insurance agent, what I do is I help explain those options that are available in your area to you, and then you get to decide what means most to you or which plan you would like to enroll in, so that you're deciding what best fits your needs. So that's what a Part B reimbursement reduction Giveback plan is. It's a Medicare Advantage plan that gives money back into your Social Security check each month. Now, if you have any questions about whether or not these types of plans may be a good fit for you, feel free to give us a call or send us an email. We'd be more than happy to go over the options available to you in your area. Make sure you give our video a like and subscribe to our channel. And if you have any other questions, please feel free to reach out to us and we'll get back to you.